Welcome. I'm Stephanie Townsend Ayala, your video host for the El Paso Eldercare channel. Today, we're talking about innovations in home health care with registered nurse Ann McConnell with Tender Care Home Health. Welcome, Ann. How are you today?
I'm doing great. How are you doing yourself?
Good. Thank you. So glad to have you here today. I'm really interested in learning what you do in terms of chronic disease management. What is that?
Well, what we have found with Medicare and hospital readmissions is that the majority of the diseases that are costing the most costliest readmissions to the hospital are your chronic disease. Your diseases like congestive heart failure, chronic obstructive pulmonary disease, and
COPD.
And diabetes. And so what we did was, as an agency, we became chronic disease certified. I mean, all our nurses and clinicians are chronic disease certified. And what we do is we engage the patient in a trusting relationship, and we educate them to self-manage their disease process. And we get them by making them do it and working with us to apply it so that they understand what all those numbers mean. So in other words, we'll give them like what we call the zones. We got the zones where if you're in the green zone, that means you have no increase in respiratory distress today, you've had no weight gain in your heart failure patient, then you're in the green zone, okay? And now if you're in the yellow zone, maybe you've gained 2 pounds or 3 pounds, and then what do you do about it?
Or lost weight.
What we're looking for in heart failures is weight gains, because
okay.
a significant weight gain, even just 2 pounds in 24 hours, can mean that their heart is having an exacerbation.
Oh, really?
So we can catch those things at home, work closely with their medical physician, and be able to get the patient treated, so that way they don't have to end up back in the hospital.
So you're avoiding readmissions.
Completely. We've been able to reduce the readmissions drastically for several of the hospitals here in El Paso.
Wow, that's so difficult to do. And when you're talking about chronic disease management, where does the shelter nurse program come into that?
Okay, the shelter nurse program is a partnership that we have with the UMC hospital, and is through a grant through the HHSC. It's called the Regional Health Partnership. I don't know if you've heard of that, but with the Affordable Care Act, a lot of money was given to this area. And so what Medicare was trying to do, and CMS, is to try to for us to be innovative. How can we reduce money and reduce costs, but at the same time, giving quality and not having it affect its quality? So we partnered with UMC on their care navigation project when they discharge patients. So we work with patients, we work with the discharge planners and how to improve the discharge process.
So people don't just go home.
They're not, well, they do go home, but they go home with home care.
So how does that work, practically speaking? You actually come to the home?
We go to the patients. It depends on the patient's needs. It could be daily if they need it. It could be just once or twice. It could be to evaluate their wound. It could be until they can get the UMC can get them into their outpatient clinics. So we work closely, and every patient's individualized. But one of the other programs, we got 2 other programs. One is with the Salvation Army, and one is with the Rescue Mission. And what we did was we put a nurse there, a registered nurse at that facility, and they're doing wellness and physicals, and they're able to catch things and identify and send the patients to the clinics. So you're catching these patients way before they end up back in the emergency room, where they end up in ICU for a week.
And it's good because it's not just, of course it's important that we save the dollars,
right,
but it's also helping somebody avoid getting to the point where they need a hospitalization.
Right.
Like if you can catch a decubitus ulcer,
right,
then before it
prevent it to getting worse.
Yes, and then you can avoid a lot of the chronic hospitalizations. And and it's not just about the hospitalizations, it's about the suffering
and what the patients have to go through. People don't want to be in the hospital. And they wait and wait until sometimes they're so sick they have to. So that's the unfortunate part. But when you have clinicians who are here and they're caring about you, and you trust them, and you gain that trust, and we work with them on their behavioral changes. We use motivational interviewing, and so we really are able to work with them to get them, find out what motivates them to make these changes, so that they see it's to their benefit to maybe weigh themselves every day, or it's their benefit to take their diabetic medications. And so it's really all about education, and the more and patients have benefited from it, and to the point where they're telling us, you know how much sodium this can of food has, or this frozen is better than this, and they're educating our nurses. And so that's when you know it's working.
Once you start reading labels, it's a little scary.
So much, but they can do it, and the way adults learn, we use principles of adult education, and it's by applying. They have to be able to apply their knowledge. So we go into their house and we take down all of the things from the cabinets, and we have them sort it. And what's high and what's low sodium
that's
by
brilliant.
reading labels. So this way if they're getting it, not just going and just teaching a paper, taking their blood pressure
It's
and
about
getting out.
education.
It's all about education and making
Wow.
sure that the patient is benefiting from it. And once the patient sees there's a value, then they'll have the confidence to be able to do what they need to do.
It's so funny because, I've said this many times, and I think that we're all learning what goes in your mouth and how much you move every day affects your lifetime.
Definitely.
For the rest of your life. It affects how long and the quality. But one of the problems we see with people who have chronic disease is there's so much depression.
There is.
How do you help them come out of that in terms of motivating them and trying to, especially when you're an elderly person and you've been depressed and no one's visiting you and you can't go to your lunchtime socials and you can't do what you used to do. How do you help them with that?
Well, first of all, we do depression screening on every patient. So we do what they call the PHQ-2 depression screening score. And if that comes out positive, then we do another depression screening score. And that gets sent to the physician. And if the physician decides to how he wants to treat it, if not, then the physician may make a referral to some type of a counselor or a psychiatrist to be able to give them to put the patients on the right medications to deal with the depression. Because it is true, as long as patients are depressed, they're more likely not to want to participate in their plan of care.
Practically speaking, what do you do? Like when you find somebody that does score high on a depression list, then what are the practical elements that you can use to help them?
For the depression, well, we also have social workers that we can send out to the patient's home that will also help them at the same time. But it's just, first of all, getting them on the right medication, the right setting, and just with the behavioral changes itself. I mean, when you work on their behavior with the motivational interviewing, when they start seeing that their blood sugars are getting better, and that because of their actions they can control their weights or their blood, their hearts, it starts getting them a value. And what we do is we first find out what their long-term goal is. So what, from having congestive heart failure, are you doing now that you have not been able to do for a while?
Right.
And like a patient will say, maybe it's having to not be able to swim again, or I can't go fishing again. So then everything we do, we link it back to their long-term goal. And so before you know it, they're happy because they see the results of everything they're doing is working, and now they have the energy to be able to go do things that they haven't done in a long time.
This is so informative. Thank you so much. We're going to come back to that topic in just a second. We're speaking now with Ann McConnell. She's a registered nurse at Eldercare Home Health. We'll be right back. Welcome back to the El Paso Eldercare channel. Today we're talking with Ann McConnell, registered nurse at Eldercare Home Health, and we're talking about depression and helping a family in the home after the hospitalization to keep improving. And I find sometimes it's not the client who's giving us trouble in the home, it's sometimes the loving family members. They don't realize they're hurting their family. They're saying, but she loves her enchiladas, and you're like, well, she can't have them anymore.
Right. Well, the thing is it's all education. And, we educate them on their diet, on their nutrition. I mean, the nurse will go in and teach patients how to count the carbs, and it's not like you can't have it. You just have to have a consistent amount of the carbs. And so it's really changed a lot from the old days where you could never eat sugar again, So you patients can have carbs, but it has to be a consistent amount on a daily basis so that they're on the right medication to be able to cover them.
Well, the thing is, I have a daughter who has to have a special diet now, and it changed everybody's diet.
Yeah, it does.
We all changed. Right. The entire house, it changed shopping habits. Yeah. And it's hard to do in a family setting.
And that's in a way the beauty of it, because once we teach grandma how to eat right, and they're having to cook right for the grandma, then it's affecting the whole family, who tends to sometimes run with a higher incidence of getting diabetes. And so this way they're learning at the same time.
That's great. And that person's if their loved one is as depressed, then it makes it easier for everybody in the house, doesn't it?
Very much so.
So tell me again about we were talking earlier about the shelter nurse program.
Well, the shelter nurse program worked out great because we're able to put a nurse there at the rescue mission and one at the Salvation Army, and so they come in and they get interviewed, they get assessed, and then we are able to work with we have a medical director to see what we need to do with them, maybe send them to the clinics, and so we're able to catch some diseases. For example, we had this young girl and her mom said, I need her to have her blood sugar checked. Well, they found it was over 500, and so she was able to get them into the clinics right away, get her on the right medications. And so for a while this little girl she was 18, 19, been feeling really bad. So we get the patients into the right setting. Where before,
and I have to say that those two agencies, Salvation Army and the Rescue Mission, I just want to say a big shout out to both of those agencies for the work they do in our community.
It is awesome.
And Blake Barrow is such an amazing gift to
Yeah.
the folks who are on the edges of financial.
Right. And you see
survival.
how much they help people. And where before people had a headache and they would just call EMS and go to the ER and have brain scans and everything. Just all they needed was Tylenol. So now we can assess patients. So we're really cutting costs on those kind of things, because we have seen a drastic readmission, a drastic reduction of the EMS calls for both of those facilities. So just by having a clinician there.
What
So
a
it's really
testimony.
finding ways to improve health and lower the quality, and improving your quality and lowering the cost. Sorry.
And what about a lot of people are so afraid of acute care discharging, the navigation, they can't go home. What about that?
Well, it is scary. I mean, I remember, I've been a nurse for 34 years now,
Wow.
and I remember when we used to do open heart surgeries, they'd be in the hospital for 3 weeks.
Oh my goodness.
Now, 3 or 4 days, they're coming home.
Wow.
And so these patients and we're asking a whole lot of our patients. Patients are very complex. We're asking them to check blood sugars, we're asking them to check weights, we're asking them to take medications. We're asking them to call us if your blood pressure, if your blood sugars are between this and this, if you gain more than 2 pounds in 24 hours. I mean, there's a lot of things we're asking for patients. So patients need help, and they need help by education, and they need and you need someone to be able to go into the home and find out if they're not getting better, then why not. I call it CSI home health.
CSI?
It is, because a lot of times, they'll be on the right medications, the right everything, but then what is it? Well, we find out, it's because my brother-in-law brought some medicine from Juarez, and he's giving it to
no.
him. So then that interacted with this, and that's why your heart rate went up.
And the herbal remedies.
The herbal
that
remedies.
may or may not need.
So we have to use our nurses. That's why nurses in home care now, they really have to have tremendous critical thinking skills, because you're always looking to see if they're not getting better, then why not? What is really going on with your patients? And we work closely with our physicians. We're very blessed to have fantastic staff and working with some great physicians here in El Paso, and that's what helped us grow.
And a lot of people, I've seen clients who end up in nursing homes just from self-neglect.
Yes.
They're not eating right, they're not getting their doctor's visits, they're not getting their medications.
Yeah.
And so how can you deal with that if they have to go back home alone?
What we do is we identify, and if they are in self-neglect, we notify Adult Protective Services.
They
We
really
work
do
closely
help
with
in those
them.
situations.
And they do come in, and evaluate the patients, and sometimes they put them in foster homes, or sometimes they've had to put them in a skilled facility. Our whole goal is to try to keep patients at home, but it has to be. It has to be safe, and it has to be safe for them. If once it's not safe for them and they're a danger to themselves or to others, then we have to look at getting Adult Protective Services in.
Yeah, and that's the term, the 3 magic words, the least restrictive means. We
Right.
want everyone to be free and to have their home and to be comfortable without any restrictions on what your activities are. But oftentimes, even going home isn't enough.
Right. So a lot of times they need that extra help. And so sometimes, we'll get provider services in the home, and that can help them, and we can work with the providers. We really encourage family, participation, but it's hard. We're in the sandwich generation. People have to work, and so that's why, it helps to have agencies out here that are there to help. That you're not alone out there.
What would the one thing that you'd like people to know that you find your clients are just completely unaware of? What are some of the misconceptions?
Well, I think that they need to know more about power of attorneys, like the services that you can offer them at the same time, because a lot of times it gets to the point where they can't make their own decisions, and it's not safe for them to make decisions, and the families, don't want to make that decision for them. And so it does make it tough.
I appreciate you bringing that up, and since you did, I'm going to say this. I believe that everyone 18 or over should have 5 legal documents: a durable power of attorney for money, medical power of attorney for medical decisions, a healthcare directive saying if you want to be kept alive by extraordinary means if you're in a vegetative state, a declaration of a guardianship in case the court ever gets in the middle of your life, and a will. And if every adult 18 and over had those, we could avoid a lot of legal fees in court battles. What have you seen when people don't get that? I'm really glad you brought that up. I appreciate it, because again, it's about educating people, and you can't do your job if people are fighting.
Yeah. We usually try to find who's going to be, who is going to be the one that's making the decisions for that, and work closely with them. And there's times that we have to case conference and bring them in and talk with the professionals and have the physician there as well, and then we actually decide on how we're going to handle this. What is the next step for this patient?
And you have to get Adult Protective Services involved.
There's many a times, and a lot of times it's not for bad. They come in for good. People
Right.
think that we're mean for doing that. No.
No.
Our job, and it's our duty to report when we find a patient that is endangered or endangering themselves or self-neglect, or someone's taking abuse or, exploiting these patients.
There's
So
a-
these are times that we have to report by law.
And by Samaritan law, that's what you're referring
Right.
to, the
Yeah.
law in Texas that says if you are aware, you don't have to know that it's absolutely happening, but if you are aware that an incapacitated or an elderly person might be abused, neglected, or exploited, even by themselves, if they're just neglecting themselves, then you must, under penalty of criminal law, you must report it. That number is 1-800-252-5400, 1-800-252-5400. I have it on speed dial on my phone. There's
We do too.
oftentimes that
We
we
do
have to do it as professionals in this area.
But I have seen them come in, and like if a patient needed to be in a foster home or a situation like that, then they can do it. If they need an increase in their provider hours, they will increase their hours. So we work with them as well,
That's
just to
right.
get the best for the patient, to try to keep them at home.
Yeah, they can
They can
accomplish
increase that,
things
yes.
that you cannot, or I
We
cannot
cannot do.
accomplish, because they do have the force of the state government behind them.
Right.
And while their role can be limited, but they play a very important role sometimes in helping just to bring some peace in a chaotic moment.
Right.
And that can often happen. What are some of the things that you would like the public to know before they even come to you? Before they even need your services, what do you wish they would know, other than getting their legal work done?
Yeah. Well, it's really what we do is assess to find out what it is they know. Because a lot of times people come with a lot of knowledge. And so we just need to know that if it's, if it's the correct knowledge for that it's right. Because sometimes they'll maybe Google things and think they know this is this, but it's really not. And so what we need to do is first assess what knowledge they have, and then what is it that we need them to know. And then that's how we make our teaching plan and then educate them.
That is so wonderful that you're doing that. And I know, in fact, you and your agency, Tendercare Home Health, are reaching out to the senators in both Texas and New
Right.
Mexico, Steve Pierce and Jose Rodriguez. How are
Yes.
they helping us right now?
Well, actually, I'm on Senator Rodriguez's Healthcare Alliance. And what we do is we're looking at trying to find ways to educate, because El Paso is different and very different than it is up east, where a lot of the rules and things are made. And so what we've done, I was able to bring the chronic disease program that we got from up east and bring it here to El Paso, where we're educating all our nurses. I'm actually educating clinicians at the hospital, and especially the cardiac units that we go and that we're teaching about chronic disease. So we do classes, and before I used to teach patients, now I teach nurses. And so we're all talking the same talk, it's real important.
What's the overall mission, the stated mission?
The whole mission is to get patients to manage their disease process, for them to understand when they have to call the doctor, when they have to go to the hospital, when is it okay, when they're seeing that it's getting worse, what do they have to do, and know what they have to do about it.
So overall, it's just about becoming aware. It's so interesting that you say that, because everybody comes to my office and asks me to make them a will. So everyone knows they're going to die, but no one comes in and says, I need a medical power of attorney, I need a durable power of attorney, because I plan to be chronically ill for a decade before I die.
Right. No.
Nobody ever does that. Nobody ever thinks they're going to need your services.
Exactly.
But the reality is 75% of us are going to need you in our home or in a nursing home before we pass away. So we're going to have to close here, but on some closing thoughts. Do you have any closing thoughts for people to take away?
Well, I believe in healthcare, and I believe in home care. I believe this is true nursing. This is what we went to school for and learned, and how to take care of patients in their home. And there are a lot of budget cuts that are being hit. So we ask everybody to call their congressmen, call their senators, and please tell them to save home care, because we are the answer to reduce costs. We're a lot more cheaper to send them and keep them patients in their home than to have them in a skilled facility.
And it's more fun,
And,
too, for
and
the
that's just where
patients.
patients want to be. They don't want to be in a skilled facility.
That's right.
So
Wow.
we ask for everybody's help to put the word out there, talk to your congressmen and your representatives, and to please to help us save home care.
Thank you so much. What a wonderful message. What a great time talking with you. We've been speaking today with Ann McConnell, registered nurse for Tendercare Home Health. Thanks for joining us here at the El Paso Eldercare channel. We'll see you again real soon.
Thank you very much.